to visit an expectant mother.
She was already going through something hard. She was pregnant with her third child.
And who had just lost her son the day before.
And as we were talking to this woman and just seeing her situation, where she lived,
it's something that you can't fathom.
It was so upsetting to me. These people need healthcare.
Put into perspective how lucky we are to have access to resources just so that we can live comfortably.
The Ghanaians are people that, just like us, they have all sorts of hopes and dreams, and they live their lives the best way they know how.
It really increased my desire to help these people.
It made me realize the gravity of what we're dealing with maternal health, and it also fired my ambition to be more dedicated to the cause of allowing more women access to healthcare, and also in turn giving their children greater access.
These mothers are the lucky ones. Hundreds of women die during childbirth each year in rural Ghana because of the distance that keeps them from accessing the necessary care. A clinic full of educated doctors and nurses like this one is usually too far and thus too expensive for women living in remote villages.
These moms are dying unnecessarily because they're pregnant and because they're giving birth to their children.
There is no actual records of them giving birth at home, and in many cases dying in rural villages, and their death goes undocumented.
MAAME means mother in Twi, one language of the Ghanaian people. With their focus on maternal health, a group of college students from Brigham Young University decided to use it as their team name.
MAAME stands for Maternal and Antenatal Mobile Education. We thought that represented what we do really well.
I actually was introduced to this project by a flyer. It was about the Y Prize Challenge, and the initiative was maternal health, and that really appealed to me. And so I went to the meeting, formed a team, and we decided that we were going to go to Ghana.
After researching different technologies, the students decided to focus their efforts on a solution that would help bridge the gap between healthcare and pregnant mothers in rural villages. They decided to use Medic Mobile, a non-profit organization working in over 20 countries.
It's about letting these people have a voice. It's about getting their needs recognized and understood, because there are thousands and thousands of people in these rural villages that can't get on Facebook and say, I have really serious health problems, I'm worried about my baby. These are people that just won't be heard unless something like this is brought into their community. That's what Medic Mobile is all about.
The students made contact with Mr. Sami Ofosu, the District Health Director of Ghana Health Services in the Akasimo Odebenbrakwa district. Sami embraced the proposal to implement Medic Mobile in his district and began a one-year pilot program.
The use of the Medic Mobile, pregnant women will be tracked right from their communities, right from the inception of the pregnancy through to delivery.
Medic Mobile, for our year-long pilot program is serving as a data collection base.
We know that there are people that are suffering and dying in these areas that just go undocumented. And so Medic Mobile allows us to see where these women are, what their need is, and how we can better help them.
After a 17-hour flight and a long 3-hour bumpy ride from the airport, the team met up at his health clinic at Asikuma. Sammy took the BYU students on a tour of the different health facilities throughout the district, including hospital, health clinics, and community-based health planning and services centres.
Which do you like? This one? Butter? Oh, sugar.
Merchants sell fish, plantain chips and crackers along the busy parts of the town. Little honking taxi cars dodge goats and pedestrians scurrying across the windy roads. Continuing on the pothole-filled dirt roads emerges a lush, green, humid jungle overgrown with mango, banana and plantain trees. Women in bright-coloured dresses and babies strapped to their back effortlessly carry tubs of goods on their heads. In between thick vegetation are mud and wood shacks with tin roofs, homes to humble but happy families. Moving into a dormitory room at a hospital in Asikuma, the MAAME team spent the next 6 weeks living among the people. Ten hand-selected community health workers from the Asikuma district were invited to a Medic Mobile training.
So you all just registered a new person, okay? So that's the first step to any person, any
The Medic Mobile app allows the community health workers to keep a close track on expectant mothers so they know exactly when to visit their homes for checkups, vaccinations and deliveries.
We were really grateful to see how excited they were about the program. They were all committed, they were all engaged.
Each health worker was provided with a smartphone and learned how to use the Medic Mobile app. They practiced how to register a pregnant mother onto the app through role plays.
She traveled 2 weeks ago. Oh, okay. Please, did she deliver before traveling?
I loved this training because it was more of a collaborative effort. It was a really good way for us to be able to see how Medic Mobile would fit with the healthcare workers and also what the healthcare workers could do to improve what we were giving them.
The next morning, the team accompanied 2 nurses to their villages where they visited pregnant mothers. Instead of recording medical information with a pen and paper, the nurses registered each mother on their new mobile device.
I think Medic Mobile is amazing. I think it's come to stay because it'll make my work more easier. Having the records of all my pregnant women, keeping track of them when they get their time to attend antenatal clinics, if there's a danger sign, and most of all, their expected date of delivery. Yes, so I think Medic Mobile is amazing.
With the paper record, after I finish with it, I'll have to send it back to director so that he can see the work we've done so far. But with the phone, he can see it even when he's in his office. So Medic Mobile so far is good.
And all of the mothers we visited were unique.
Many mothers choose not to deliver their baby in a health facility. They feel more comfortable delivering at home near family as they have done for generations. This mother, however, plans to deliver at a health facility. She feels safer with skilled doctors and nurses by her side. Armed with the Medic Mobile app, the community health nurses can now better care for mothers by tracking their pre- and postnatal needs.
This program is going to succeed because of community health workers. Going to be the driving force behind this. We're just giving the tools to these people to do what they have always wanted to do, to serve their communities and to help the people around them.
The word that comes to mind when I think of the women in Ghana is just the word strength. For them, oftentimes being pregnant is a sacrifice, and so there is that risk that they could be giving their life by bringing another life into the world. And that is one of the most selfless acts that I think anyone is capable of doing, and it was really amazing to be able to meet these women who had many children and that were willing to bring life into this world despite the complications, despite the difficulties that might arise in their own lives.
Medic Mobile has increased the effectiveness of nurses and improved communication between nurses and patients. Better communication means access to care.
And we thank you for bringing Medic Mobile to us. Most pregnant women are coming to the hospital for care because they are being reminded by the community health nurses to always see their midwives on time. And it is really helping us. It is really, really helping.
In just 4 months, these health workers have registered more than 100 mothers on the mobile health app. The start of change in a rural village that can spread to the rest of Ghana and to all of Africa.
I would strongly recommend that other areas should be included because it is a good thing. We are embracing technology and we hope that it is going to help improve the health services in the country.
Adisha's baby died, and technology cannot bring him back. But better communication through technology will save the lives of mothers and children.
Despite all our cultural barriers, the difference in language, our different lifestyles, we're able to connect with these people that have lives and that have families and that have mothers who have children. We're all human and we all want to live to our fullest measure, and that's only possible if we can continue living.